Hello, everyone. My name is Grace Achampong. Welcome to my presentation for Research Applications 1 and 2 at Ontario Tech University Faculty of Health Sciences. I'm excited to share my research proposal with you today. Cervicogenic headaches aren't your typical headache. Unlike migraines or tension headaches that originate in the brain, CGH are rooted in the cervical spine. This musculoskeletal issue often stems from dysfunctions in the joints, muscles, or nerves of the neck, potentially causing pain to radiate to the head, face, or shoulders. If you've ever experienced that particular pain, know that our research is targeted towards finding solutions. Therefore, our research aims to answer a key question. Does radial extracorporeal shockwave therapy, combined with standard physiotherapy, reduce headache frequency more effectively than physiotherapy alone, or sham shockwave in adults aged 18 to 65 with chronic cervicogenic headaches in the Durham region or Greater Toronto Area over a 6-month period? Here's an overview of my research proposal. I will begin with background information and objectives, followed by a discussion of the study methods, statistical analysis, and ethical considerations. Next, I will address the limitations of the research, concluding with a summary of the study's expected contributions. Cervicogenic headache affects 0.17 to 2.2% of the general population, but is more common in specific groups, such as over 50% of individuals with whiplash injuries. It is also more prevalent in women, with 31% of nurses reporting neck disability and 27% reporting headache disability. Trauma plays a significant role as around 60% of whiplash patients experience headaches. CGH can severely impact daily life, with chronic pain, stiffness, and restricted mobility, disrupting work, sleep, and social activities. Many also experience stress, anxiety, and depression, further reducing their well-being. Cervicogenic headache imposes significant economic cost, with chronic migraine costing just over $25,000 per patient annually, including lost productivity and accounting for 7 million lost workdays yearly. While physiotherapy is the standard cervicogenic headache treatment, it often provides incomplete relief. This study explores whether combining radial extracorporeal shockwave therapy with physiotherapy more effectively reduces headache frequency, improves pain relief, and enhances quality of life compared to physiotherapy alone or placebo, assessing headache frequency, pain neck function, and muscle health. In Ontario, the College of Physiotherapists ensures physiotherapists provide safe, evidence-based care, including procedures like diagnoses, joint adjustments, and energy-based treatments. This allows therapies like radial shockwave therapy, a Health Canada-approved non-invasive treatment, to be integrated into care plans for cervicogenic headache. Shockwave therapy uses pressure waves to promote healing, reduce pain, and improve movement, offering a promising solution for managing chronic headaches. The International Headache Society classifies cervicogenic headaches as a type of secondary headache caused by neck problems and makes up about 1 in 5 cases. This highlights the need for affordable, non-invasive treatment. Non-drug approaches can work as well as medication for some headache types, cutting headache frequency by 34 to 78%. And physiotherapy is an effective approach for managing CGH. However, some patients continue to experience persistent symptoms, highlighting the need for further research into non-drug treatment such as shockwave therapy. My analysis of extracorporeal shockwave therapy research for cervicogenic headache reveals both promising outcomes and critical gaps. Let's examine the findings from 6 recent studies. Mahmoud et al. In 2022 studied 15 patients with myofascial trigger points in the upper trapezius. After 3 shockwave sessions in 1 week, the patient reported less pain and better neck function. However, the small sample size limits how widely these results apply. Haman et al. In 2024 conducted a double-blind randomized trial with 50 CGH patients. One group received shockwave and physiotherapy, while the control group had sham shockwave and physiotherapy alone. The shockwave group significantly improved headache disability, pain levels, and upper trapezius muscle function. The study's strong design, including a control group and blinding, makes the results more reliable. Rabar et al. In 2021 conducted a single-blind randomized trial on 72 people with neck and upper back muscle pain. They compared shockwave therapy, ultrasound therapy, and self-stretching exercises. After 4 weeks, the shockwave therapy group had the most pain relief, with an average pain reduction of 1.77 compared to 1.20 for ultrasound therapy. This supports shockwave therapy as a promising option for neck and upper back pain. Theo et al. Studied younger adults with visual display terminal syndrome, a condition caused by too much smartphone use. Among 20 participants, those who received shockwave therapy had significant pain relief, while the control group saw no change. These results suggest shockwave therapy could help with tech-related muscle strain, a growing issue today. Takakawa et al. In 2023 reported on a 45-year-old man with chronic headaches that did not improve with standard treatments. He underwent a combined approach, including shockwave therapy, and experienced significant pain relief after 11 weeks. While case studies have limits, shockwave therapy could help treat chronic headaches as part of a broader care plan. Zia et al. In 2024 conducted a study with 42 participants comparing shockwave and hands-on therapy for tight painful spots in the sternocleidomastoid muscle. Both treatments worked equally well in reducing pain and stiffness while improving function. The shockwave group received 3 sessions. These findings show shockwaves as a good alternative to manual therapy, though more long-term research is needed. Shockwave therapy shows promise for musculoskeletal conditions, but current evidence is limited by small sample sizes, short follow-up periods, and variable protocols. Studies provide low to moderate quality evidence with insufficient comparisons to standard treatments. These limitations highlight the need for larger, well-designed randomized controlled trials with standardized protocols and longer follow-ups to establish shockwave therapy's efficacy and safety. Recent studies show promise for shockwave therapy, especially when combined with other therapies, in improving pain and function for various musculoskeletal conditions. However, significant gaps in shockwave research for cervicogenic headache include unclear long-term effects and non-standardized protocols. Our study addresses these by using a standardized shockwave protocol and comparing combined shockwave and physiotherapy to physiotherapy alone and sham shockwave. This approach aligns with current trends in shockwave research, focusing on optimizing treatment parameters and synergistic effects with other therapies. Our study aims to determine the effectiveness of shockwave therapy for chronic CGH. The primary objective is to assess whether adding shockwave therapy to standard physiotherapy reduces headache frequency in adults with chronic CGH compared to physiotherapy alone or with sham shockwave therapy in the Durham and Greater Toronto area. The primary outcome measures is the reduction in headache frequency measured in days per month. Our secondary outcomes include pain intensity measured by the visual analog scale, neck disability using the Neck Disability Index, cervical range of motion, and headache-related disability assessed with the Headache Disability Index and Headache Impact Test 6. We will also evaluate quality of life using SF-36, medication usage in doses per month, and the sternocleidomastoid muscles pressure pain threshold and shear elastic modulus. These comprehensive measures will provide valuable insights into Shockwave's benefits for cervicogenic headaches, informing clinical practice. To rigorously evaluate the effectiveness of shockwave therapy for chronic cervicogenic headaches, we are conducting a randomized controlled trial in Durham and GTA to evaluate shockwave therapy for chronic cervicogenic headaches. 3 groups will be compared: shockwave and physio, sham shockwave and physio, and physiotherapy alone. The 4-week treatment will be assessed at baseline, 4 weeks, 3 months, and 6 months to capture short and long-term effects. Our study will include adults aged 18 to 65 with cervicogenic headaches meeting ICHD 3 criteria, including evidence of a cervical spine disorder causing headaches for at least 3 months, and pain intensity greater or equal to 4 on a 10-point VAS scale. Participants' headaches must show specific patterns of development, resolution, and exasperation, and relief from diagnostic blockade. These criteria ensure we target the appropriate population for evaluating shockwave therapy's effectiveness in treating chronic cervicogenic headaches. We will exclude participants who are pregnant, have had recent neck surgery, have primary headache disorders, use blood thinners, have severe mental health conditions, or have received Botox injections or shockwave therapy. This rigorous selection process ensures a well-defined study population and maintains participant safety and study validity. We aim to recruit 120 individuals from the Durham and Greater Toronto area over a 6 to 12-month period. This number ensures the validity of our results. To ensure balance across the study groups, we also stratified randomization. We will consider factors like age, gender, headache severity, baseline medication use, and psychological influences on pain perception. This study evaluates the effectiveness of combining shockwave therapy with physiotherapy for chronic cervicogenic headaches, adhering to IHS diagnostic criteria to ensure applicability. We'll recruit participants from physiotherapy clinics and hospitals in Durham and GTA using professional networks, healthcare channels, and primary care referrals. An online pre-screening system will efficiently assess eligibility before enrollment. This randomized controlled trial will evaluate shockwave combined with physiotherapy for chronic cervicogenic headaches, randomly assigning participants to shockwave plus physio, jam shockwave plus physio, or physiotherapy alone. The extracorporeal shockwave therapy protocol uses parameters within established ranges, specifically 2000 pulses at 0.25 millijoules per millimeter squared and 8 Hz, delivered weekly for 4 weeks. Radial shockwave will target myofascial trigger points, while sham shockwave mimics sensation without therapeutic effect. All groups receive standardized physiotherapy, including manual therapy for sternocleidomastoid muscle trigger points, ensuring consistency and differentiating shockwave efficacy from placebo effects. The primary outcome is a change in headache frequency, days per month. Secondary outcomes include pain intensity, VAS, functional disability, NDI, cervical range of motion, headache-specific disability, HDI and HIT6, quality of life, SF36, and medication consumption. Blinded evaluators will assess outcomes at baseline, 4 weeks post-intervention, and at 3 and 6-month follow-up to minimize bias and maintain study integrity. The null hypothesis states no statistically significant difference in the reduction of cervicogenic headache frequency among the 3 groups: shockwave plus physio, jam shockwave plus physio, and physiotherapy alone after 6 months of treatment. Conversely, the alternative hypothesis posits that at least 2 groups will show a statistically significant difference in headache frequency reduction over the same period. This alternative hypothesis remains two-sided, considering multiple possible outcomes. Shockwave plus physio may be more or less effective than physiotherapy alone. Shockwave plus physio may be more or less effective than sham shockwave plus physiotherapy, and sham shockwave plus physiotherapy may be more or less effective than physiotherapy alone. The study aligns with best practices in headache research by centering the analysis on headache frequency as a primary outcome and using a 6-month assessment period. This structured approach clearly evaluates shockwave-specific therapeutic effects while accounting for potential placebo influences. To enhance reliability and minimize bias, blinded evaluators will conduct inter-observer measurements. All assessments will follow standardized protocols to ensure consistency across data collection points. Measurements will be taken at baseline, immediately post-intervention at 4 weeks, and at 3 and 6-month follow-ups to evaluate short-term and long-term treatment effects. Headache frequency will be analyzed using ANOVA or Kruskal-Wallis tests to compare groups at each time point. Secondary outcomes will be evaluated with repeated measures, ANOVA or mixed effect models. Post-hoc Tukey's HSD tests will be conducted for detecting differences, with Bonferroni correction applied. This approach rigorously evaluates Shockwave's effectiveness for cervicogenic headaches, addressing headache-specific and quality-of-life outcomes while accounting for placebo effect. Multivariate regression models will adjust for potential confounders like age, gender, and baseline headache severity. Subgroup analyses will explore treatment effects based on initial headache frequency and symptom duration. The Bonferroni correction will control for type 1 errors for multiple comparisons. This comprehensive approach ensures a rigorous evaluation of Shockwave with physiotherapy for cervicogenic headaches, accounting for confounders and placebo effects to produce reliable, clinically meaningful results. This study adheres to ethical guidelines from the College of Physiotherapists of Ontario, Tri-Council Policy Statement, Ethical Conduct for Research Involving Humans, TCPS2, and Research Ethics Board. Key principles include informed consent, participant safety, and equitable participation. To ensure inclusivity and accessibility, we will implement several strategies. We plan to recruit diverse samples from both Durham and the Greater Toronto Area and provide multilingual resources and culturally sensitive support. A hub and spoke model will be used for treatment locations to improve accessibility. We will also extend recruitment and treatment periods to accommodate more participants. Additionally, we will collaborate with physiotherapy associations to develop training programs, enhancing the study's reach and impact. Extracorporeal shockwave therapy is a non-invasive treatment, aligns with minimal risk principles. All 3 groups receive active treatment, adhering to beneficence. The study will undergo ethical review, with data securely stored and anonymized. Ongoing safety monitoring, ethical reflection, and transparent dissemination of findings will be prioritized. To address participant follow-up and retention, staff will send reminders and offer incentives. Confounding factors will be documented. The team will collaborate with existing clinics and provide specialized training to overcome limited access to equipped facilities and trained physiotherapists. This research aims to expand understanding of shockwave therapy combined with physiotherapy for chronic cervicogenic headaches, with implications for scientific knowledge, clinical practice, and health policy. This study's findings have the potential to 1. Enhance headache management by improving access to effective evidence-based treatments for chronic cervicogenic headaches. 2. Inform education and training programs for physiotherapists, facilitating the integration of shockwave therapy into clinical practice. And 3. Guide future research, funding decisions, and resource allocation for non-invasive headache treatments. 4. Inform treatment protocols for other musculoskeletal conditions. 5. Contribute to more equitable health outcomes for individuals experiencing chronic pain in the broader population. 6. Shape future clinical practices and healthcare policies. This concludes the presentation on the proposed study exploring the role of shockwave therapy and physiotherapy for cervicogenic headaches. Thank you for your attention.